Hey guys, Dr. Anthony Davis at the Davis Medical Group and Body Goal MD in East Texas. Today we're going to talk about migraines. Now this is a serious topic, so I really want to stress the importance that this is not medical advice. This is for your information. I do think that there are some critical things you need to know. So if you have migraines, if you think you have migraines, really watch this video. Down below, please click subscribe to the YouTube channel. Watch the videos. There's a bunch of really good stuff out there. Comment below if you have any questions or if you want to request a particular video. This one's going to be straightforward: migraine headaches. Okay, so before we get started with migraine headaches, let's talk about the things I want you to watch for, because there's some red flags and I think they're very important. The first thing is, if you're having any of these things, these are red flags. We're past worrying about typical migraines or classic migraines. These are the things where you should seek help immediately. First, if this is the first or worst headache of your life and you've never had one before, that's dramatic. We don't know what that is. Don't think, oh, I've got those symptoms, so this worst headache of my life is probably a migraine. Don't ignore that. If you're over 40 or 50 and you've never had a headache before and all of a sudden you've got a disabling headache, that's an emergency room visit. Don't play around with this. If you notice that your headaches are getting more severe or more frequent, that's a change in your baseline pattern. So we worry about that. You certainly worry about medication overuse, particularly pain medicines, ibuprofen, Tylenol. If you take a bunch of those over and over and over again, then your headaches will start rebounding. And when the medicine wears off, you'll actually withdraw from the medicine and trigger a headache. If this is a sudden onset, brand new headache, you've never had it before, and it reaches severity within an hour, that's a problem. We don't want to play around with that. If you're fine, but then you do something strenuous, like climb some stairs or go walking or have sex, and all of a sudden you get a sharp headache, that's a problem. We don't want exertional triggers. Or if coughing triggers a headache, that's also not normal. So really what we're looking for is a change in pattern, a change in frequency, a change in severity. If any of that's happening, stop what you're doing, turn this off, go get help immediately. Now, let's talk about good old-fashioned migraines. So how common are migraines? First off, you got to know that women outnumber men 3 to 1. And in the last 25 years, there's been over 50 million people diagnosed with migraines. 50 million in this country. That's crazy. And so this is a serious problem. I bet we see it every week in the clinic. And it wasn't until recently that we had some new treatments that came about. So where do they come from? You would think that with the science and the technology that we have, we would be able to tell you exactly where they come from. It would be easy to treat it. We'd say, oh, you've got a migraine, so this is how you fix that. Don't get not so fast. Not so fast. I can't count how many times I've told people, don't know why you have migraines. We think, oh, this triggers it, that triggers it, this triggers it, that triggers it. We always thought it was blood vessel dilation and constriction. There's something to that. There's something to the blood vessels stretching and then bouncing back that does cause the migraines. The question is, what causes the blood vessels to stretch and contract? That's a good question. There's a nerve. It's shaped like that. It goes through your ear, comes out of your spinal cord, goes through your ear, and it's split into 3. So it's called the trigeminal nerve. For complex medical terminology, the trigeminal nerve. That nerve gets activated, and that seems to be a pretty good piece of the puzzle. So it goes round and round. So the end result is, we're not 100% sure. Some of the new medicines that are working, these monoclonal antibodies, don't worry too much about the technology, they work on migraines. So there's going to be quite a bit of development on the science side as we move forward about what causes migraines, or at least what causes some people's migraines. So there are different types of migraines, right? We classify them scientifically in episodic, chronic, and complicated. So episodic migraines would be your 1 or 2 times a month. So that's a episodic migraine. But if you do the math on that, that's 12 to 24 a year. That's pretty dramatic. A chronic migraine, get this, more than 15 a month. And then for the official diagnosis, that has to be more than 3 months in a row. But goodness sakes, how debilitating is that? It's really exciting nowadays. We have more new medicines for that, but our old medicines can work. We need to get the migraines under control. And certainly since the science is lagging behind, it can be difficult. So what is a complicated migraine? You're going to have increasing neurologic symptoms. Can't feel half your face, can't move half your face or arm or leg, messing up your vision, messing up your hearing, messing up your nose. Migraines can do all that stuff and even cause long-term damage to the brain if they're not controlled. And the more neurologic symptoms you have, the higher risk you are for developing a stroke from it. So migraines are serious business. And then certainly, many of you know this, migraines can be menstrual. They come at the same time every month about your cycle, and you know they're coming, you know you're going to get it. And you know, something very important about migraines is they're not just a mild headache. They are, by definition, disabling. The symptoms are disabling. Like, it takes you out of your normal cycle of life and you cannot function at a normal level. So how do you recognize a migraine? Oh goodness. It's like some of the other medical problems that we deal with around here. The symptom list includes everything from my nose itches to vomiting my guts up. And so really we're looking for a prodrome. So let's start with that, the prodrome. Migraines kind of have this warning signal, almost like an early warning signal for hurricanes. And it can start 24 hours before the headache occurs. And it can be weird. You can be excitable. You can be irritable. You can be starving, increased hunger cravings for certain foods. You can be depressed, sleepy, fatigued, even yawning shows up on the list. And so these are so weird. You can even have this kind of heightened sense of external stimuli pushing you a little bit, like noises and sounds and smells. Like you're triggered, like you smell certain smells that are very strong. All of those things can be a prodrome to a migraine. And if you've ever had migraines, you know what I'm talking about. You know. And so the prodrome, if your migraines come with an aura, the aura is very fascinating. So many migraines do come with an aura. It's 50% with an aura, 50% without an aura. And when I say aura, A-U-R-A, aura, you know, like the glowing that the psychic sees behind your head, an aura, typically we're talking about a change in your vision. I had a friend of mine, he was an artist, and he once made a multimedia painting of what an aura looked like. And I have had migraines. I've got them when I was in junior high. And I couldn't describe to you what an aura looked like, but when I looked at that painting, I was like, that's an aura. There it is. It's overlapping areas of dark spots and flashing lights. And you almost, for me, it feels like there's a pillar here, and I'm kind of trying to look around it. And as soon as that happens, I know within an hour, if I don't do something, I will go into a full-blown migraine. Now that I've figured that out, I don't go into a full-blown migraine. So I know how to intervene with mine, and that's something we can help you with in the clinic. I'm lucky enough that if I just take the right medicine, over-the-counter medicine, boom, it clears it right up. And I know what I'm looking for. And for me, even a trigger is bright lights. If I get a bright flash off of a windshield, boom, I can almost immediately tell that I've triggered a migraine in myself. So who knows? Maybe you could figure that out and tell me what that is. So when you go from the aura to the headache phase looks like this. So we move into the headache phase. You know, us doctors, we're kind of famous for our mnemonics. We take a word, almost like NASA, and it means something. So we use in headache migraines, particularly, we use the mnemonic POUND, P-O-U-N-D, pound. P stands for pulsatile. Classically, migraines are pulsatile. They don't have to be. So it gets tricky. All of these things are classical. If you're going to look on a multiple choice question, this is what you're going to look for. POUND, pulsatile. 1 day duration, there's your O. Unilateral, typically can be on one side or the other. Doesn't have to be. N, nausea, vomiting. That's the first question you ask somebody when they have a headache. Are you nauseous? Have you vomited? And then the D, P-O-U-N-D, D is they're disabling. I mean, you have to stop what you're doing. You have to go. Why? Because about the only thing that's going to fix it on your own is sleep. So they are relieved by sleep most of the time. The duration is typically 4 to 72 hours. For most people, I mean, if you're lucky enough to have a 4-hour migraine, wow, cool. But they can last up to 3 days. If a headache lasts up more than 72 hours, it's time to do some due diligence and work that up. So I just mentioned triggers. Triggers for me, my trigger is bright light. I remember when I was in junior high and I was trying to play football, and I'd go outside and do football practice, and I'd get a headache every day, and I didn't know what was wrong with me. If I knew then what I know now, I'd wear some sunglasses and take a couple ibuprofens, and I would have been able to stay out in that sun all day long. And that's what I do now, so I don't have to worry about it. I can take ibuprofen before I go outside because the sun might trigger a migraine. I haven't had one in decades because I know what that looks like. And so what I ask patients to do is you need to keep a diary of your headaches and what you ate, what kind of exercise or exposure you had prior to that, because we may be able to find your triggers, and then we may be able to block that. So, you know, we're dancing around the science. We still don't know what it is, but everyone's got triggers. Something is triggering them, and we want to figure out what that is and try to avoid it. So, finally, treatment. How do we treat it? Oh, man, there are a lot of ways to treat it. If you can't figure out what the triggers are and you're not lucky like me, I know I'm the luckiest migraine patient there is. bright lights. I get a prodrome. I get a warning. I get an aura, a scintillating scotoma. Love that word, scintillating scotoma. Your vision kind of whoop, flips in on itself. I immediately take some medicine and it goes away. But most people are not that lucky. So we have medicines. We have lots of medicines. And there are protocols that we follow. It's difficult to just say, oh, do this natural thing or take this vitamin or do that. Certainly hormone balance helps a lot of people's migraines. It's estrogen related, it's menstrual. Certainly trigger avoidance helps others. But this is something you need to come see us in the clinic. So go to your clinic, go to your doctor, come in, see us for migraines. We have a lot to do. And we have some really cool modern day medicines that involve getting a tiniest, don't freak when I say this, shot in your stomach. Tiny little bitty shot. Little kids do it in their tummy once a month. And your migraines will be cut in half in severity and cut in half in frequency. I'm not selling medications, but I do think that migraines are one of those serious things that you want to control them. The more migraines you have, the more likely you are to have long-term complications. And it can be hit or miss. I know that when we see MRIs from people that have chronic migraines, you can see damage to that brain. So we want to control them, have as few as possible, figure out what your triggers are, keep your diary, go to your provider, come see me with a diary of your last 5 to 10 headaches and what was the pattern. Maybe there's something that shows up. Anyway, migraine headaches. That's the 101 on migraines. Come see us at the Davis Medical Group. We're happy to help you. We know about migraines. We can help you. Have a great day. My last request, please, down there's a subscribe button. If you like this video, give me one of those. Thumbs up. I would appreciate that greatly. We're building the YouTube channel as we speak. I have a lot to share with you. Comment below. Let me know what you liked, what you didn't like. Don't be cruel. Be constructive. We're going to move forward with whatever topic that you ask me for. I certainly have plenty that I find myself doing during the day. And I write, oh, that's a good idea. I need to write that down. A lot of times I'll just record these videos so that I can send my patients to the YouTube channel without having to spend an extra 15 minutes and they can really hear me discuss the condition that they have. But I would appreciate you subscribing, liking, sharing with your friends. Click the little bell down there when you hear a video, or when I post a new video, it'll notify you and you'll watch that. So have a great day. Thank you. Bye.